Hi, this is Dr. Wayne Whalen with HelpWhatHurts.com. Most of the patients I see, new patients I see in my office, have never been to a chiropractor and not too sure what to expect. And they know if they go to their medical doctor with some kind of musculoskeletal like a problem like neck pain or back pain or shoulders, whatever, they're likely to get an anti-inflammatory medication or a prescription for pain medicine or perhaps some muscle relaxants. But they're not too sure what's going to happen when they go to the chiropractor. So I try to explain to them how we approach things a little differently than their physician might. And I like to use this analogy. Think of like a 1967 fastback Shelby Mustang with the racing stripes to do 160 miles an hour down the freeway. Unless, of course, you drive it into a pothole, knock the whole front end out of alignment, in which case, might do 140 miles an hour, but it's not going to be pretty. So you can slap a new, you can, if you keep driving on that car with the front end out of alignment, pretty soon that tire's going to go. So you can slap a new tire on it, keep driving on it, pretty soon that tire's going to go. So you can slap a new tire on it, keep drive again, now the tire's going to go, and now the shock's going to go. So you can put a new tire on it, put new shocks on it, keep driving on it, pretty soon now you got the tire's going to go, the shocks are going to go, and you got to rattle in your engine block you never had before. So you can wax the car, you can put STP in the gas tank, you can hang fuzzy dice for the mirrors, none of which is going to fix the problem, right? It's the front end that's out of alignment. And if you look at the car parked at the curb, you have no idea if that's the problem or not. It only really shows itself when you're driving it. So bodies work similarly in some ways, and that's kind of how chiropractors approach this. We look at things in terms of mechanics of how those joints work. So if a joint's supposed to fit together like this, and it's like this, well, it may not work like it's supposed to. If the muscles that support that joint are too tight or too weak, it's not going to work like it's supposed to. If the nerve that innervates the muscles in the joint in that area are irritated, it's going to irritate the muscle. It's going to make the muscle tighter. That's going to jam up the joint some more, which is going to irritate the nerve more. It's going to make the muscle tighter. Round and round. So you get the picture. So as a chiropractor, that's what I look for. Is there mechanical dysfunction at the joint level? So if there is, then I have a number of tools in my toolbox that I can use to help restore normal mechanics. For example, I can use manipulation, and there's lots of different kinds of manipulation to help restore motion to the joint. I can do various kinds of therapies to resolve or reduce inflammation, nerve irritation. I can teach specific stretches and exercises and that sort of stuff to restore normal muscle function. And if I can get the joint to go back to working like it's supposed to, then the body works like it's supposed to. So I hope that's been a helpful little overview or insight into how it is that chiropractors approach musculoskeletal problems.